So that was the end of part 1. What do you think? Do you think we heal the wound? Do you think she loses the toe? Do you think she loses the leg? Not going to tell you. You're going to have to stay tuned for part 2 of this diabetic wound journey.
Because it hasn't been x-rayed.
Right. So because
weeks.
this is just taking, I mean, the original wound is healed, but this little one is taking a while. Let's just get an x-ray and make sure that there's no infection in the bone underneath this, because that would keep it from healing. Because this actually looks a little bit larger than it did last time. So my guess is that you haven't been off it a whole lot.
Right.
Are you hosting Easter this weekend?
Yes.
All right, probably wasn't the best plan to keep you off of this, but it is what it is. So after Easter is done, I want you off this as much as you can. Because right where this wound is right where you get all the pressure.
Sure.
When, you know, when you're walking, because of the shape of this toe, all your pressure goes right there. And so this is not getting any relief every time you're weight bearing or bearing weight. It gets pressure, and every time you walk on it, you know, that could set you back a few days. So I get that you got to do Easter because you're hosting.
Right.
But after Easter, I want you to take the post-Easter week and really stay off this as much as you can. Okay? Do you think you could do one of those knee scooters?
Well, I still have it.
And your right knee is okay on that?
I have such a hard time when I'm on the scooter moving my right leg. I feel like I'm going to either topple over or it just is not good.
Okay.
But, you know, I mean, I can stay off. We do have a walker, and I was going to try that too. Our house is not that big. Like, it's 20 steps from my living room to my bathroom.
Okay. Because the other thing I can do is we can get you a post-operative shoe, you know, one of those flat black ones.
Oh, isn't that what I got?
Yes, it is.
Yeah, I've been wearing that.
All right, I'm going to do some adjustments on that today to help offload this spot. Now you've got another little crack up here going kind of perpendicular to where the initial one was. But again, it's just because you've been on your feet a lot and you've got a lot of callus buildup. So one thing I'm going to do today is I'm going to use my sander and we're going to get a lot of that callus off. All right, so we're here a week later and this whole fissure is well healed, and this, you said this open area that right here that's lower down, that was from a piece of tape?
From, yeah.
I'd have to go back and look at the initial videos that we did to see if that's accurate or if this actually was the original wound. I don't remember.
No, I think that fissure was.
Okay.
Because I thought it was just cracked skin.
Yeah. And oftentimes it is. All right, so let's just get this a little bit bloody so that the edges can start to close in together. Okay. So we're looking at 0.7 by 0.3. that fissure is remaining closed. And then a lot of this excess peeling down under here, if there had been a lot of swelling in that toe and the swelling goes down, the outer layers of skin aren't elastic, so they peel off instead of going down with the swelling. So that's what all this peeling under here is, not to worry about any of it. Okay, so let's keep putting the Meta Honey right on the base of this wound here. And let's see you next week. And after that, we can maybe go every other week until it's all healed.
Okay.
But it looks good. It's not infected. The base is good and healthy. And I think this should be healed up in a couple of weeks. Okay? Okay, so it looks like there's some drainage. I can't tell. Is that from a sock or is that the wound draining?
I don't think, I mean, it's hardly been any drainage.
Okay.
Doesn't it look better?
It does. But now there's a new crack up here.
Well, I wondered about that. I thought, oh, geez.
All right. Well, whatever you did differently over these last, was it 2 weeks, did we go?
Yeah.
Whatever you've done differently, it worked. Because
I
this...
stayed home and I haven't gone anywhere.
Okay. It's still open just a tiny bit.
I can hardly stuff that stuff in.
Right, I know. So if you wanted to just, at this point, you know, we could, well, I'm opening it up, so you'll be able to get a little piece, a teeny piece,
Sure.
like about the size that you had on here. And then maybe we go back to see you in 1 week so that everything doesn't get so thick and dried out here in between. Sometimes...
But it hasn't been red. You know, I was done with my antibiotic probably, it was either Sunday or Monday.
So it's got some overhang here where the skin is kind of hanging over the wound. So I'm going to trim that away. Is this hurting?
No, but if I'm watching.
Yeah, don't watch. I mean, so yeah, keep going with that wound care dressing I gave you because it is working. And we're just not quite done. Now let's just make sure this doesn't go deep enough. Now it's interesting, this crack is perpendicular to the initial one, because the initial one went that way, yeah?
Yep.
Right. Just gonna put a little pressure on this for a second here. All right. So let's, just because I don't want this crack going deep enough to create another wound. Let's have you back in a week, because that really did seem to be working. Sometimes giving somebody that extra week does help the wound heal a little faster, but in your case, it just allowed a second crack.
And after after my company left, I mean, I've been really good. I haven't gone anywhere and
Yeah.
haven't been walking around up and down the stairs or anything, so.
Okay. So we're 3 millimeters by 2 millimeters. I think that's a little bit bigger than last time.
Oh, I don't.
No?
Do you think so? No.
I'll have to go look. So I'm just going to clean all this up. Okay. All right. So I'm going to just smooth it all down here. Just using this because we're not in the room where I have the power sander.
Right.
But this will get rid of any sharp edges. Okay, I will go get some of that wound dressing to put on and, okay, be right back. Okay, so for 2 millimeters by 3 millimeters, you just really need a teeny little piece of this, and you push it all the way down in. Okay, and that's for you.
Okay.
And then, so let's just get this one little teeny pinpoint drop of blood to stop bleeding before I send you home. And I'll just put a little antibiotic on that spot and it'll be fine. Now, in between putting your dressings on, you can put lotion on all the rest of this.
Okay.
Especially because you're not using an adhesive bandage.
Right.
So lotion's not going to stop anything from sticking. So, yeah. So you won't need any antibiotic on that after today. So that's not an issue. And then you're changing that wound dressing every other day, correct?
Well, I have been kind of doing it every day just because I want to look at it.
Okay. And that, you know what, that's fine too. And that's okay. I mean, it will either absorb into the wound or it won't.
Or it'll fall out, right?
Right. And if the wound is looking really dry when you put it on, excuse me, you can always put a couple drops of water on it just to moisten it.
Oh, okay.
And we'll do one more here, make it look nicer. Has to look better when you leave here than it did when you walk in. Okay. All right. Well, thanks for letting me video again.
Yeah.
All right, let's take out this wound dressing here. So last time this was 3 millimeters by 2 millimeters. Yeah, this is getting, this little spot right here is getting more and more shallow. So that's the good news. Okay. And then this was the new little crack or fissure. I'm just going to take a little bit off of that, so I don't send you home bleeding again. And the rest of this we'll just do with the sander. Okay, but this literally, we're now 3 millimeters by probably 1. Yeah, it's like 3 millimeters by 1 millimeter. So it is getting smaller and it is getting more shallow.
Good.
Yeah, let's just sand some of this down. that looks a ton better now.
Crap.
Yeah, I can maybe even do a little more along here.
What about that toenail?
Yeah, not looking great, but it's not causing any of the issues.
No, but it's kind of real jagged. Do you think?
Let's get a little bit more of this stuff. All right, so when is your next regular nail appointment for?
The 12th through the 13th.
So a couple weeks?
Yeah.
Okay. So we'll just go ahead and keep doing what we're doing. We'll get this nail thinned out and shortened quite a bit at that appointment.
Yep.
And it's moving along. You know, the original fissure's gone. This one isn't full thickness anymore, and this is getting shallower. So we're on our way. You know, it's taking longer than we thought, but it's moving in the right direction.
Good.
Okay, so if this hasn't changed at all today, you know, I'm thinking about why would this not be healing? And the first thing I think of is, well, you know, just you're not being off of it enough. And it still has pressure from the shoe and the ground. The second reason could be if the bone underneath this wound is infected at all, that would stop the bone from healing. So at that point, I think if the dimensions haven't changed, then I think maybe we need to get an MRI to make sure that there's no bone infection underneath. Because if bone is infected deep to these wounds, they won't heal. So I don't think that's the case here, but I'm short of putting you in a wheelchair.
I mean, I was really good this week.
And to me, it looks better, but, you know, the measurements are the measurements.
Right.
So... yeah, so last time it was 2 millimeters by 3 millimeters.
Right.
And let's see. Well, it's looking like 2 by 2 now. All right, so let's hold off on getting an MRI. And as good as you've been this past week, let's have you keep being that good and staying off it as much as possible.
Yeah, because I see you next week for my toenail cut.
Okay.
The regular maintenance.
All right, so as annoying as it is to try to be off your feet without a shoe on, I'm going to say over this next week, do your best. It's so small and it is so close to being healed. All right, so I'm just going to make it bleed a little bit here. Okay. All right, well, I think we're getting there. And if I could put you in a wheelchair and have you stay off the... But I don't think that's reasonable. Now, do I recall that you had a knee scooter initially?
Yes, I still have it.
All right. So I might recommend, you know, even around the house if you can, just keeping your shoe off, and you even use that as much as you can to get this puppy healed. Okay? It's so close. It could just be one more week. If I could put you in a hospital bed and make you stay there for the week, I would do that. So use the knee scooter and stay off of it as much as possible over this next week. And I mean, there's a good chance that 1 to 2 more visits, and I know I've said this before, but 1 to 2 more visits, I think that we can get this sucker healed. Okay?
Yes.
Because that looked like bleeding here, and it looks like the dressing is not. It's not in the wound. The wound is up here.
Right.
And so that moved, or you didn't get it in the right spot. So okay.
It probably moved.
Okay. Well, this is the best it's looked since we started.
Oh, good.
Yeah. It looks mostly healed, and this is the only area right here where there's still an open wound. Right here, and so it's just kind of right in the center of where it was.
Oh, great.
Right, just right here. That's the only spot that's open now. So we are looking at like 4 millimeters by 2 millimeters. No, I don't even think it's 4. I think it's more like 3 by 2. So that's definitely smaller, and it's definitely more shallow. So it's moving in the right direction, and we will get this healed. So, good job.